What is photobiomodulation? Can light really modulate cellular responses to promote healing in our bodies? And can lasers replace those dreaded drills in dentistry to offer less painful procedures? I'm really lucky and grateful to have Dr. Jason Pang on my channel today to answer these and other questions about how health practitioners can utilise light therapy for maximum effects and how it can benefit you. Here's Jason. Thank you. Honestly, thank you for taking the time. I really do appreciate your knowledge and yeah, just taking the time to talk about this topic, because I know you're really passionate about photobiomodulation. And to start with, I really wanted to ask you, what is photobiomodulation? If you could explain it in the way that I know that you can.
Well, I mean, photobiomodulation, the word, photo meaning light and bio meaning cells, and then modulation meaning that you can improve or reduce the effects that the body has on the cells itself. So, I mean, if you've ever watched any science fiction sort of film, even Star Trek, or even something like the Avengers, you know, you might have seen where a person gets injured and they wave some sort of light or some sort of device over the wound, and you see it magically knitting back together. And really, kind of that's actually what photobiomodulation is. It's kind of using that light as a way for the body to repair itself, to reduce the pain, reduce the inflammation, and heal. So, you know, it happens naturally, but you know, in the movies, it happens very, very quickly, and in real life, it just doesn't happen quite as quickly as that. So that's the main difference. Yeah.
And how does it actually work? Tell us what it's doing on a cellular level.
So on a cellular level, what happens is the light actually penetrates into the mitochondria of the cell. So the mitochondria is the powerhouse of the cell. It makes the ATP, which powers all of the functions of the cell. And when a cell is actually stressed, what we consider stressed, it actually has a nitric oxide molecule bound to the cytochrome C, which is what makes the ATP. So when that nitric oxide is bound to it, it's kind of like the engine of a car that's dirty. So it's just not performing very well. And when the light hits it, that nitric oxide molecule comes off it. It actually binds then to an oxygen molecule, and then you have the cytochrome C start to produce the ATP very, very effectively. And then all the good things that happen as a result of a cell working well, you know, start to happen. So all of the cell signaling starts to work, all of the molecules that it needs to make and send to the other cells. Communication with the nucleus happens much more effectively, you know, and at the same time, that nitric oxide molecule passes out of the cell. And nitric oxide is actually a vasodilator, which means that it actually encourages blood flow into those surrounding areas. So all those good things happen. You have the cell working better, you have reduced inflammation, you have reduced pain, and then you have increased blood flow as a result of this nitric oxide molecule coming out. So that's what really happens at a cellular level. So, I mean, that is kind of akin to, you know, a plant. When a plant is trying to produce the energy, it uses sunlight. So photobiomodulation is very much a photochemical reaction where, you know, instead of producing energy for a plant, you start to get all the energy at a cellular level, you know, to the individual cells, so they can do all the things that they need to do. And often we talk about cells being stressed or sick, and they can either, you know, sometimes cells will actually die, But when you actually give them the energy to survive, it actually shifts the focus to survival, and so all of a sudden they can start to repair rather than go through what we call apoptosis or autophagy, which is where they actually recycle all the bits that they need to use. So it's a very nice thing that we can help do for our patients.
Oh, absolutely. That's absolutely fantastic. Well, how is photobiomodulation used in dentistry?
Wow, photobiomodulation, interestingly, it's still one of the most underutilized things in dentistry. I mean, I wish more dentists would try this fantastic technology and start to use it, but there are just so many things that we've started to use it for. In typically some of the major things that we do as dentists is obviously cut teeth and take teeth out. So for instance, when a tooth is taken out, you have an extraction socket there. We apply the light to the socket so that you have the healing very quick around the area, but at the same time you have the joint that might be affected because of having to open for so long. So we can apply it to that joint so that the joint isn't sore. We do things like root canal procedures where we may have the patient in the chair for a long period of time and we've got them open, and then we're going right into the bottom of the tooth to take out the nerves, and that can be sensitive as well. So we can use that light right at the end of the tooth to make the tooth less sensitive, so that area heals well. And again, on the joint, so that because they're open for so long. But other things that patients sort of don't realize is they may have tinnitus, say from an injury or something like that, maybe a blow to the jaw. You can have rings. So tinnitus is ringing in the ears. So we can actually do a treatment for the ringing in the ears. We have any sort of wound in the mouth, we can actually help to heal up more quickly as well. So a little cut or an ulcer, something like that, we can help to heal more quickly. And then we do things like place implants. And implants need to heal and need to set into the bone, so that can happen more quickly. The bone is more firm around the implant. And then we have things like gum disease, where the gums might be quite irritated and swollen, and we can help to reduce that swelling. We can have the lymphatic drainage around the tooth, which is speeded up, so that those swellings come down. At a more extreme level, sometimes you probably have heard of people having cold sores.
Yeah.
Cold sores are something that we can apply. We use different types of lasers and the photobiomodulation to treat those, but we can prevent a cold sore from becoming full blown. So when it's in that tingling stage, we can actually stop it, and so it doesn't become full blown, and it just starts to heal from then on. If you go to that's herpes simplex. If you have, say, herpes zoster, which is shingles, that can affect the face, and it can affect the muscles in the face, and so you can get a facial palsy sometimes. And we can use that around the muscles of the face for them for the muscles to start working again much more quickly, so the patient can get facial movement back again and start to use their mouth to close their eyes again, which is all really, really important things. And there's so many other sort of conditions around the mouth, like you can have burning mouth syndrome, you can have trigeminal neuralgia, all sorts of pain conditions, even pain in the joints and things like that, which can be really dramatically improved with photobiomodulation.
That's fascinating. The tinnitus, is that how you say it? Tinnitus, the ringing in your ears?
Yeah.
Yeah, I have heard of that condition, and I've heard that it's pretty much incurable. Like you can't really do anything about it once you've got it. But are you saying that light therapy can actually help that condition?
There are different types of tinnitus. So tinnitus can be caused by many different things, but there is a type of tinnitus that is caused by injuries to the jaw or blow to the jaw, and it affects the nerve that's related, the auricular nerve sort of related to that. And so if we can treat in and around the ear, we can actually help the tinnitus improve. You know, for some of the more traditional types, which are neurologically based, yeah, that's much more difficult to treat. But they're doing studies on how to treat that as well.
Oh, that's great. And oral mucositis. I know that I've had a look at your website and some of your information. And apparently you can treat oral mucositis with that, with light therapy too, um, especially cancer patients.
Absolutely.
Yeah.
Yeah,
So,
so one of the really nasty side effects of chemotherapy, radiotherapy,
yeah.
is actually getting these giant mouth ulcers, and we call it oral mucositis.
Yeah.
So it's, you know, it's something that affects a lot of people. A lot of people are undergoing sort of chemo or radiotherapy, and they consider that the most debilitating part of the whole procedure. It can be so bad sometimes that they would actually prefer to stop the cancer treatment, you know, rather than have these giant ulcers in their mouth. So since over the last 2 years, internationally the recommendations have come to the point where the light treatment and photobiomodulation is now the recommended treatment. So the National Institute for Health and Care Excellence in the UK, which governs how the NHS practice, they recommend the light therapy for that. And there's a multinational association for supportive care in cancer. They, again, very strongly recommend the light therapy for treating oral mucositis. So if you can actually treat the mucositis even before it starts, so if prior to chemotherapy or radiotherapy, before the lesions actually start, if you can get to the patients at that stage, you can prevent the mucositis from being so bad, from getting to the point where it will prevent them from, you know, being able to eat and being able to drink and so on. So it's a really nice, you know, treatment that we can provide, because these patients they're often suffering. But even if they have had chemotherapy, it just helps those ulcers to heal up more quickly. I mean, one of the I just completed a thesis for my master's in laser dentistry, and I was using a particular type of laser, an ND-YAG. It's a dental laser, and with a special handpiece that's used specifically for photobiomodulation. And with that, we were able to quite effectively treat, you know, a large area, you know, large lesions at a time, and it just helps them to heal up so much more quickly, which is just, you know, such a benefit to these patients.
Oh, absolutely. And that's really interesting about what you said about pre-treating. So if you're going to be going into chemotherapy, are you saying that you can shine light on the tissue, and is that upregulating the tissue to then guard itself against further future insults, and so it's able to ward off the oral mucositis better?
Yes, yeah, that seems to be the way that it works. So,
That's great.
you know, often if when you actually shine the light onto the cells, you get what they call a transient reactive oxygen species response. So when that transient response happens, the body says, whoa, hang on, I've got to try and deal with this. So it's kind of primed and ready to actually deal with any kind of assault that happens next. So there have been studies where, for instance, prior to going out into the sun and sunbaking, if you do that, you're less likely to get a sunburn. You know, so it's a nice pre-treatment that you can do. Yeah. So what it also means is that for in dentistry, you know, rather than say, we don't have to just take out the tooth and then do the treatment, we can actually do it at the start of the treatment, and then the response can be really good. Yeah.
When you say at the start of the treatment, do you mean on the first visit when you're there in the dentist chair, or do you mean you go in separately, have the light therapy, and then you come back for the procedure several days or a week later? Or
Most No, most often it's so we can do it just immediately prior to doing the, you know, say the extraction or the root treatment. We can just do it, you know, 5 minutes before, or while we're waiting for the anesthetic to work, we can do it. So yeah, because sometimes we get a bit tied up at the end, and we're sort of talking to the patient about things, and we sometimes forget to use it at the end, but we can actually use it before as well, which is good.
That's so good. Well, tell me how you have heard about photobiomodulation. How did you get onto light therapy?
So I started in 2009 with what we call an all tissue laser. So that's a laser that is used for cutting gums and for cutting bone. And it wasn't probably until about 2015 when I was doing a master's in laser dentistry overseas that I was exposed to what photobiomodulation could do. One of my colleagues that was in the course with me, she had back pain. And so one of my other colleagues went, oh yes, let's use the laser and treat your back pain. So, you know, she's there in pain, and all of a sudden he grabs the laser and he's using it on her back, and she's feeling so much better. And it's an instant, instant type of pain relief that she was getting. So, you know, that was really my first introduction to that. And, you know, since then, of course, there have been so many more different types of treatments that we can do. And we're finding out sort of more each day, because it seems that, you know, not only is it, we initially used to think that it's just conditions that are inflammatory. Mm-hmm. So, you know, say, you know, typically when you think of something that's inflammatory, you might think of, say, rheumatoid arthritis, or, you know, irritable bowel or something like that. But what happens is, because it seems to improve the blood flow into those areas, even areas that have poor blood flow, like in the TM joint, just seem to improve very, very quickly from doing a therapy like this.
That's great. Do all dentists use, because when you said in 2009 you were using a laser already in dentistry, do all dentists use lasers to cut teeth now, but they just don't utilize it for the healing benefits, or not?
No, absolutely not. No, like it would be nice. So look, you know, my own personal perspective is that I think in the future, every dentist will eventually have some sort of laser that they'll be using in their clinic. But right now, only probably about 10% of dentists might have any sort of laser at all. And
how did
the majority of those would.
How did you pick one up then in 2009? Like, did someone introduce you to the laser initially, or did you do your own research?
So in 2009, I went to a user group meeting, and I had a colleague sort of say to me, look, we've got this fantastic, you know, tool. It allows us to cut the teeth. We can cut into the bone. We can cut the gums, you know, and it heals up so quickly. And, you know, and, you know, it's a real sort of fantastic tool for the office. You know, everybody should get one. And I was like, oh, okay, well, I'll investigate this. And so did a bit of research, and, you know, and found, you know, that there was, you know, these, you know, they did exist. There were these great little lasers. You know, they were quite expensive, and they still are. But this particular one was you know, is a big one. It's about half the size of me, and it at that time it never actually really lived up to its promise. It wasn't the type of laser that could do everything quite as good as you'd hope. I mean, yes, it can cut teeth, but it wasn't very quick at it. You know, you could cut the teeth, but, you know, the patient would still feel sensitivity, you know, things like that. And, you know, I didn't use it as much as I would have liked to. But then all that kind of changed in 2015 when, you know, that I was introduced to another laser It's called the Fotona LightWalker because it's really it's in a class of its own, because it actually has two lasers built into the one machine, and it's just been a workhorse because I've just used it pretty much continuously since 2015. Every day it just sits next to me, and I've got it on, and we use it for for most of our patients nowadays. It's just been a game changer for me in terms of how my practice runs.
The big question that everyone wants answered: can lasers replace drills for less painful procedures? Like, basically, is a laser less painful than a drill? Like, can you actually remove decay with a laser as you would with a drill?
Yes, absolutely. You can. I mean, nowadays with the new lasers, it works really well. The process is that the laser uses, depending on the wavelength. So what we call an erbium YAG laser, it will actually seek water, and so it will actually vaporize any cells that have water, which is pretty much everything. So, and it can do it very quickly, and in just very thin layers. So you don't have that energy being transferred into the center of the tooth. You just have it used on wherever you point. It will just, the tissues will just vaporize. So that's really good for small cavities, because you can just very quickly remove the decay, and at the same time, the energy, it doesn't cause damage inside the tooth, so there is no sensitivity. But it's a really nice procedure for people that are either scared of the drill, or they don't like needles, or they don't like pain, which nobody likes pain. But it's fantastic for those kind of people. And the times where when the patient is really fearful to come to the dentist, that's when a laser is quite a game changer for them.
Oh,
but having said that,
I was just going to say, so does it not hurt? Like, do you not feel that sort of horrible sensation when the drill's going?
Well, if the tooth is already quite sensitive and painful, then it can still be painful, right? But when a tooth is not painful and you're actually drilling down into it to remove the decay, those are great cases to do. And it's an obvious question for someone like yourself, but that is actually the most common question that I get from dentists. So, I know that you, having seen some of my videos, would actually know more than a lot of dentists out there. But when dentists ask me that question, really, the drill does a fantastic job of removing the decay. And you can't use it, for instance, on metal. So you can't use it to remove an amalgam, or you couldn't, you wouldn't want to really prepare a tooth for a crown because you're shaping the tooth. You wouldn't want to use the laser for that. So that's where drills are really fantastic. But it's all about what the other things that the laser can do. So the 150, 200 sort of procedures that the laser allows you to do that are completely different to a drill. So, things like removing, mucoseals and moles around, the lips, hemangiomas, which are sort of bluish areas on the lips. You can help to treat snoring. You can use it for gum disease. You can, use it in addition for root canals, to do tongue ties on babies and adults to help them, swallow better and to feed, even treating, spider veins or even removing, hair if necessary around the lips. Those are things that you can do with the laser. That you just can't do with the drill. I mean, your drills are kind of a single purpose device, but a laser is really versatile. And once you and I probably don't know any dentist in the world that really uses it to its full capacity and using it for all of the possible things that it can do, because it's, you know, it's huge.
Oh, that's incredible. So, I mean, obviously, so lasers are safe for children.
Yeah, absolutely. I mean, we have newborns that come into the practice that, you know, they need their tongue ties done, so they may not be able to feed from their mother, and they're taking out a lot of wind, and they're really bloated and swollen, and sometimes that's because, you know, the tongue is not working efficiently to extract the milk. And we can do a very simple procedure which takes, you know, just 2 minutes to do that. It frees up the tongue, allows the tongue to express the milk, and all of a sudden you have these babies which go from being sort of tube fed, or, you know, having all these medications taking, you know, they start to be able to feed from mum. The difference can be as dramatic as, you know, from coming out from the room at the back to the front, and then the mum puts them on the breast, and they can feed again. So it's absolutely safe for children. You know, and
what is that? What is that procedure? How do you do it? The tongue tied procedure.
Yeah, that procedure. We have frenectomies and we have tongue ties. So there's an attachment that's underneath the tongue, and sometimes that goes to the tip of the tongue, which really restricts the movement of the tongue and how the tongue is able to express milk. And as well, underneath the upper lip, you can have another attachment. Sometimes that comes down too far, and that can come out right where the teeth are about to come out. So in a say a 2-year-old, sometimes you have this attachment between the two front teeth, which means that they don't want to brush their teeth at all, and it's a nightmare to try and to clean the teeth of these children. So we can revise that and reposition that so that it's a lot higher. And then later on, when they become you know, teenagers, they don't have that gap between their upper front teeth. I mean, sometimes they use it as a bit of you know, they like it, that sort of that difference in the it's a beauty, it's like a beauty mark. But, you know, if you can prevent that little bit of tissue from being in between the teeth, yes, you know, it's a lot better functionally for the teeth.
Oh, that's incredible. That's like, I know that photobiomodulation, obviously I've written a lot about photobiomodulation and its role in Parkinson's and Alzheimer's. And there are a lot of doctors and scientists now who are starting to understand the benefits of photobiomodulation. And I know it's been used with animals. So why don't more dentists know about this? And same with medical practitioners. Why is it kind of so slow to come through, do you think? Well,
I mean, there's different theories as to why that is. You know, one of the theories is certainly that it doesn't get the insurance rebate like some of the other procedures, because it's not as well known. So most often, you know, you would get I mean, it's very easy to just dispense you know, some pharmaceuticals or give a tablet for something like that. Sometimes the light therapy treatments, they do take a long time to do. You know, the first time that they started to find out these photobiomodulation was in the late 60s. But, you know, every year since then, they've been doing more and more experiments as to how to do it. Probably in the last 5 years, they've really come a long way. And the difficulty that they initially had was that they didn't know how to deliver the correct dose. They didn't have a device specific to provide the photobiomodulation. So sometimes the laser is provided in a little fiber. So it's a tiny little fiber, which when you have the light spreading out like this, and so it's concentrated in the middle. So if you wanted to use it over a particular area, you had to keep it moving, and it's very, very difficult to deliver a constant amount of energy over an area if you're moving like this, if you want to prevent an area from heating up. So now that they've got devices that are very specific, and you can have one where you can just keep it static over an area, and it's homogeneous, the amount of energy that's delivered to that whole area. That means that you can really start to deliver good science and do good research as to what is the best energy for a particular type, particular condition, and there's actually last year there was over 50 papers a month written on photobiomodulation, which is huge, and there's well over 700 randomized clinically controlled trials. Maybe about 150 of those are in humans, 150 to 200, something like that. So as that sort of information starts to filter down, then people will start using it a lot more. But I think it seems that a lot of people have heard of red light therapy more recently, and are sort of trying to find out a little bit more. So hopefully, we've all been hoping that this technology can go mainstream, but it's taken a lot longer than we all think.
Yeah, well, it's interesting you say red light therapy. That's how I first heard about it, because skin clinics use red light therapy to help with collagen production. But I know that you know about different wavelengths and the different energies. So can you explain to us the continuum of lasers?
Sure. Well, sure. When we talk about laser tissue interactions, we often think, we've seen James Bond film where there's the guy with the laser, he's about to cut James Bond, so that is, that's when you have what we call ablation. We have cutting, and that's when the laser can heat up tissues to above 100 degrees, and you have vaporization of the cells. And so that's what we do in the teeth. That might be where we're trying to trim some of the, if we're cutting a tongue tie, that might be what we're doing. But if you look at below that level, above 60 degrees or around 60 degrees, you're actually starting to denature proteins. You're coagulating the blood. You're actually killing bacteria. And so those are really nice procedures that you can do without actually, say, damaging the cells irreversibly. Mm-hmm. And then if you start to look at some of the procedures that you can do around the face and neck, you've heard of lasers being used on the skin. Yep. Those tend to be, those rejuvenation type of procedures are often transient heat procedures. So you might heat the tissues anywhere between 45 to 60 degrees just for a very brief amount of time, and so you can actually have collagen stimulated within those tissues. And then if you actually reduce the amount of energy that you deliver, and you have the cells being treated below 45 degrees, but with a specific wavelength and specific energies, that's when you can actually start to get, what we call photobiomodulation. This used to be called low-level laser therapy, but since about 2015, the better term to use is photobiomodulation, because it's more descriptive in how it's used. Like I was saying before, with the amount of energy delivered, that there is a curve which we call the Arndt-Schultz curve, and we have a response that we call the biphasic response. What it means is that it's kind of really a Goldilocks dose that we want to deliver, and if we can deliver in that range, then we can actually start to modulate the results in an appropriate way, where we can have that reduced pain, where we can have speed up healing. So that curve, if you deliver just a little amount of energy, you might have only a slight response, and then if you deliver more energy, you get a really good response. But if you give too much energy, and which is what they used to do a lot of the time in the past, because sometimes it's only 30 seconds that you might be treating these tissues, and they might be treating it for a minute or 2 minutes, and sometimes that's too much. And then you start to see the effects taper off, and you don't have a response, or the tissue doesn't seem to heal so well. So that's kind of why the good science is really, really important to get the best effect.
Well, that was my next question. How do you know what that Goldilocks just right amount is?
We have now better science so that we have a kind of a range. We know that kind of window. I mean, if you're going to get technical, we sort of say between maybe 3 to 10 joules, something like that. But then it's a matter of how you calculate it and so on. There's an art to it in terms of how you deliver that energy so that you get to the right level. Because there's no point in just treating the skin and the skin being good, whereas the problem is deeper in. So that is kind of where the art meets science.
That's probably what makes light therapy difficult, perhaps for health practitioners to get their head around as to which device do they use, what conditions do they use it on. Where can health practitioners get information like this from?
Well, there's a couple of different organizations that help to spread the word around. There's the Academy of Laser Dentistry in the US, and I helped to run the study group in Australia for that group. There's also the World Association for Photobiomodulation Therapy, WALT. That group helps to establish guidelines as to how to treat various conditions all around the body. There's the North American Association for Light Therapy, NOLT. That's another group. But in Australia there is the Australian Medical Photobiomodulation Association, AMPA, which is run by two of the foremost experts in the field, Roberta Chow and Anne Liebert. They run a local group, and which I'm a member. I know you're a member as well, and they really help to sift out some of that information and deliver good science to the people that are in the group. So we've got plenty of medical people, dentists, physiotherapists, chiros, occupational therapists, musculoskeletal people. They are all part of the solution to this problem, and they can all use this therapy to improve the response that they get from their patients.
Well, that's what I was going to say. Like if I was a dentist practicing, it sounds like to utilize lasers in my practice, I would have to do some research. I would have to do a little bit of put in some effort to learn how to use these things. Is it worth the time and effort for a health practitioner? Like, are the results that you get from patients, is it worth that time investment for a health professional to put in the hard yards and to learn a little bit about this and to start using it on their patients? What would you say?
Well, I guess it really depends on the mindset of the practitioner. Like I said, some of these procedures do take a little while to actually do. But let me give you an example of a patient that we've seen. So we had a patient that came to us, with what we call Ramsay-Hunt syndrome, and that is reactivation of the shingles, the herpes zoster virus, so shingles, but he got it in the face. And that meant that he started to have incredible pain down the back of his head. He was only able to sleep 1 to 2 hours a night. He no longer had control of the muscles of his face. He had paralysis, so he couldn't close his eye properly. He couldn't use his mouth properly. He couldn't speak, and he looked. People could look at him and they could see that there was something wrong with him. Yeah. So within 2 weeks, completely all his pain was gone, because we did with the light therapy. The muscles, within 3 weeks, they responded much better, and he could have a lot more movement. He could start to close his eye much better. I mean, to get complete use, absolutely, it did take much longer for that to happen, but it's a really nice treatment that we can do. And I think that if you're really focused on healing for your patients, then once you know what the technology can do, it's something that once you've had your eyes open, you're never going to look back. I mean, keep in mind too that, I mean, photobiomodulation is really only one of the things that the lasers can do. I mean, as a dentist, often, you know, we will do things like the root canal therapy, and nowadays with the lasers, we can use the lasers to circulate the fluid inside the tooth, create shock waves inside the tooth, and it's a much more effective way of cleaning the tooth, so that rather than 4 or 5 visits to do a root canal, we can do it in one visit. A single visit root canal treatment, you know, that's just so much more convenient for the patient. It's good for us, you know, and you know, at the same time, you know, you compress your appointments, and you can make good money from that as well. So
it must be satisfying if you can help your patients, because the doctor actually who originally told me about photobiomodulation said that like he's always searching for good therapies to use to help patients, because for many conditions there aren't many options. Like Parkinson's is a great example. There's no cure for Parkinson's, so anything that can help with symptoms is obviously, you know, really valuable. So it must be satisfying to have something up your sleeve that can genuinely help people.
yes, absolutely. I mean, now that the research is coming through, you know, the light therapy is being used for Alzheimer's, for Parkinson's, for concussion, for, you know, CTE, for brain injuries, for stroke, for depression, for you know, for movement disorders and things like that. So, you know, even, you know, possibly multiple sclerosis and things like that. You know, all these conditions that really, you know, haven't got good options in terms of treatment. There may be protective mechanisms that you know, can be affected when the body, even autoimmune conditions can be, you know, treated sometimes more effectively with this. You know, so, you know, we, as a dentist, you know, really, I'm only allowed to do the dental treatments around the mouth. But when you think about it, a wound in the mouth is no different to somewhere else in the body, or, you know, the TM joint is really no different from the knees or from the spine. So it can be used in the same way, you know, if it's used appropriately. And, you know, once you see the light come back to a patient's eyes, you know, someone that's been in pain for such a long time, and you can really you know, improve their mental health. It's quite amazing. We have, you know, patients that we treat with fibromyalgia. We have a patient that we treated with burning mouth syndrome, you know, or trigeminal neuralgia. I mean, those are very, very difficult to treat conditions where the patients will be, you know, the pain levels will be 6 out of 10 on an average, you know, and that will peak to 8 or 9 out of 10, or even post-herpetic neuralgia, which is from shingles and things like that. Those pains can last for months to years. And if we can treat those conditions really early on, we can prevent it from ever becoming a long-term problem. Like that patient with Ramsey Hunt, his pain was gone in 2 weeks. If we had left that untreated, in 6 months, he may have that pain. And sometimes, like I said, it can go for years and years. So.
Oh, that's really touching. And one thing that really moved me in one of your presentations that I saw was, I think it was a child who was going through chemotherapy, or a young boy with really severe oral mucositis. And I think it was a palliative case. And it really touched me, because you were able to help his mouth feel more comfortable, and just make his time here on earth more comfortable. And I was really moved by that one.
Yeah, I mean, those cases are really hard, you know, really, you know, they're really heartbreaking. You know, sometimes you can't, you know, I mean, there's, you know, I'll say it now, that lasers, you know, can't cure cancer, you know, per se, you know, but, you know, what we're trying to do is we're trying to help with some of those side effects.
Yeah.
You know, we know that even in the past, they did think that the lasers cause cancer, but now we've done a lot of studies to show that it doesn't. There's research coming to the fore which shows that even some cancer cells that have been exposed to the laser, that they start to move more slowly. They respond better to chemotherapy. That that they can be treated more effectively. They don't have these blood vessels around them that are protecting them in the same sort of way. But we have lasers now that can be used to detect cancer. So you can attach it to an antibody, and then you can get it to light up cancer cells. So that's a way that we're trying to use lasers to treat. And then it's possible as well to use what we call photodynamic therapy. So you can actually apply a photosensitizer to a cancer cell, and then if you hit it with an appropriate type of laser light, you can actually kill those cells as well. So so the technology is progressing, and we're getting better at using it to heal our patients, which I think is a good thing.
Fantastic. There's a doctor in the names just slipped my mind, but there's a doctor in I think it's Germany, based in Germany, who's using light therapy through intravenous light therapy, and he's having really good results treating cancers. Do you know who I'm talking about?
Yes, his name slipped my mind as well, but I know, there are ways that you can intravenously use it as well. So I think that you say even nowadays for kidney stones and things like that, they have a special type of laser that you can apply to that to shatter the kidney stones. Lithotripsy. That's really a nice way to be able to treat some of these conditions without having to go in surgically to do them. So I think lasers, once you understand what lasers can do, it's just limited by imagination as to how you're going to use it, for conditions in the body.
If you're a health practitioner, do you need a license though to utilize laser? Like, can you just buy a device and start using it on your patients, or do you actually have to do a specialized course in laser therapy?
It depends on the power of the laser itself. So, there are lasers that you can get which are very, very low power. It's something akin to a laser pointer, and you don't technically need a license to use that. But anything that's a little more stronger, we have different classes. A class 3B, for instance, laser, you would be best off doing a course which gets you certified in how to use that laser, and how to appropriately deliver the energy to that. For dentists, typically we use the class 4 laser, which is a burning laser. So that absolutely, yes, you absolutely have to have qualification to use that. But you need to actually spend much more time learning how to use those lasers for an appropriate treatment, because like anything else, it's a tool, and the tool has to be used correctly.
Oh, absolutely. What would you say to other practitioners out there who might be considering using laser and, but, haven't sort of come on board yet, or are a bit hesitant about it?
Well, I can say that, if you're an older dentist, maybe in their twilight years and looking to extend their working career, a laser is something that will bring renewed life into their practicing sort of daily life, and it is just a really nice way to be able to treat the patients. With if the patients aren't scared to come in, or if you're doing other procedures that patients really want, like for instance, we can use the lasers to treat snoring. But we say snoring because that's the kind of what people complain about. But
Yeah.
But really what we're doing is we're opening their airways so that they can breathe better, so they can sleep better. And the nice side effect is that they actually, you know, stop snoring as well. I mean,
Oh,
you've probably heard of sleep apnea, correct?
I sure have.
Yeah, pugs have a lot of sleep apnea problems as well. Yeah.
Yes, he has a lot of problems with snoring. Do you think laser could open his airways out a little bit?
That particular procedure, that's not a photobiomodulation procedure, because by definition photobiomodulation means it's not a thermal procedure.
Yeah.
The one that we want to do at the back of the throat is a collagen stimulating procedure which uses heat and which tightens up those tissues to open up that airway. So yeah, unfortunately it's a much more involved. You can't just shine some light on the neck for him.
Oh, that's a pity. But you can do it on humans, and it helps with snoring.
Yes, absolutely. It helps with snoring, and it can help them for, you know, for about a year to a year and a half at a time. And, you know, before the collagen starts to degrade again, then you might have to do a bit of a top-up procedure. But, you know, it's something that's you can do in a lunch break. It only takes maybe 20 minutes, half an hour to do. It doesn't hurt. You know, the patients can eat and drink straight away afterwards. And it's you know, it really helps with this with the snoring and you know, breathing better at night, which is what's really important. You know, like what I was trying to say before was that sleep apnea is kind of really at the high end of it. Even if you have mild sleep apnea, you're really still at the high end. You know, we want to treat patients which are at the other end of the scale, where they just maybe have just started to breathe through their mouth, or just started to snore, or have another condition which we call upper airway resistance syndrome. You know, that happens to a lot of women. You know, women often don't have sleep apnea. They'll have this upper airway resistance, which is where they start to, you know, clench and they start to have disturbed sleep. Those are conditions that we can help to treat much earlier. You know, and you know, there are some of my colleagues that also do facial aesthetics, and you know, there's treatments that they can do both on the face, which is like a very light peel, similar to what a chemical peel is, but then you can also do deeper heating procedures to get rid of some of those fine lines and get rid of, say, this nasolabial folds. You can do a treatment inside the mouth, which again stimulates the collagen to plump up those areas and to reduce the line. So it's really, you know, a very nice procedure that patients actually, you know, come to you for. You know, the things that we want to be doing as dentists are helping those patients, you know, treat things like, you know, periodontal disease and, you know, periimplantitis. So, you know, we can do procedures where we use the lasers around the deep pockets. So it effectively kind of sterilizes those pockets, but we can clean the tooth surface, make it really clean. We can create a blood clot so that the gum starts to stick to the teeth, and you actually have healing and you have new bone growth happening. You know, and the same thing around implants. We can use the lasers to clean implants without damaging the implants, and at the same time also treat the gums around the implant so that it bonds more tightly to the implant and actually helps to seal around the implant. So, you know, that's some of the really nice things that we kind of, you know, should be doing as dentists on a daily basis.
Oh, that's awesome. And what about the public though? Like, does the public accept laser therapy and light therapy, do you think, or is there skepticism in the public still about photobiomodulation and light therapy, or do you think it's becoming more acceptable, more mainstream for them too?
For the public, you know, if they hear the word lasers and dentists, they kind of think that's really high tech. That's a modern dentist.
Yeah,
They wouldn't often have heard about photomodulation that you can do in and around the mouth. They
yeah.
might have heard of light therapy or red light therapy, you know, but I think that it's coming into the vernacular now. It's becoming a conversation sort of topic, and you know, with articles like yours that are published, which show that, you know, how it can be used for things like Parkinson's. I think it's only going to be more and more talked about. So, but at the moment, yeah, look, that's certainly a point of difference for us being a laser dentist. We have patients that come to us specifically because they want us to use the laser. You know, it's only once they're in that we, you know, they mention, oh, we've got an ulcer here, and I say, oh, well, I can treat that ulcer. Or, you know, I'm getting my teeth straightened at the orthodontist, and I say, oh, well, I can use the laser to speed up the movement of those teeth. You know, so things like that are really, you know, procedures that we can do for our patients, which are, you know, nice add-ons to some of the other procedures. You know, I had a girl come in last week, and she actually had a burn. She had a burn on her face, and so, you know, we're just using the light therapy on the face. We can enable it to heal up more quickly, and you know, less likely to have a scar, and you know, and that redness sort of goes very quickly. So, you know, those are, you know, again, add-on procedures that are very beneficial for our patients.
Oh, absolutely. That's so positive. Well, you're obviously a dentist who's proactive with you know, you have a lot of knowledge about lasers. How many others in Australia like you would there be? Like, are there very few dentists using laser, or quite a few, or what sort of the number are we looking at?
It's still probably pretty few. I mean, the number that have what we call the all tissue lasers that can kind of do, you know, some of the bigger procedures, prepare teeth and so on, that would be, you know, in the hundreds. You know, the ones that are actually doing photobiomodulation, probably maybe a third, a quarter of those. You know, it's because you'd need to have specific, you have to have specific wavelengths that you can use to do the photobiomodulation, or even a specific device. And you know sometimes you know, unless you're really committed, you're not going to spend, you know, $15,000, $20,000, $30,000 on a machine that, you know, maybe just speeds up the healing a little bit quicker. That, you know, that doesn't sort of make sense. But if they've got, you know, for instance, that Fotona LightWalker, which has the two wavelengths, which is one to do all the tooth cutting, and the other wavelength to do all the healing, that really makes sense, because you can do everything from cutting the tissues to doing the healing. So it's an all-in-one unit.
Oh yeah, it sounds, and it'd probably be quite fun to get a new tool and to start experimenting with it and to learn about it to be useful. I mean, but look,
Yeah, well,
that's,
you would think that, but sometimes sometimes the dentists are very fearful of doing, you know, things that are slightly different to what they have been doing. You know, some dentists really just all they do is just drill and fill, which is, you know, just
yeah.
not what I want to do, but
Yeah, no, I can see that. Is it expensive for the public to get laser dentistry? Like, is it very expensive, basically, for the public?
no, typically, you know, a lot of the dentists, they might charge just a little bit more for a procedure.
Yeah,
But, you know, a lot of dentists, you know, that is just part of the equipment that they have.
yeah,
But when for a dentist, you know, I guess that you have to look at it as from the business case as well. And so
yeah,
if you're looking at it from, say, something like return on investment,
yeah,
you know, all of a sudden you can do, if you do, say, a snoring procedure for a patient, or you're starting to treat gum disease or periimplantitis, if you're starting to remove those lumps and bumps around the lips, you know, if you're doing one or two tongue ties, or if you start to treat, you know, burning mouth syndrome or TMJ disorders, those are now additive to the procedures that you used to be able to doing. So it's not taking away from anything, but just really adding to what they're able to do. And so, you know, it becomes, you know, very cost effective for the dentist to then own some of this equipment, and hopefully pass on some of those savings to their patients as well. You know, certainly, you know, in my role as part of the Academy of Laser Dentistry, I teach dentists around the country how to get into lasers, how to use the lasers, you know, and use it most effectively. There's training programs to, you know, so that they can become very effective in the use of lasers. And then there's overseas master's courses, which you know will really go in depth and teach dentists how to, you know, use these for a myriad of things that they've probably never even thought of.
Oh, that's fantastic. I really hope that we can get the word out there more and let more health professionals and more of the public too know about the benefits of light therapy, laser therapy, because it can only benefit the body, really, can't it?
Well, I think the only thing that I would say was that is if you're a dentist that hasn't been exposed to what lasers can do, then, you know, I think you owe it to yourself, to your profession, to get educated in what's possible. Find out, you know, some of these additional procedures which can actually enhance your dentistry to get you better results for the patients, and then, you know, spend the time and hopefully maybe the money as well to get some of the equipment that can really, you know, be of benefit and be of service to mankind, so that you know, you're really becoming part of the solution, you know, because so many people are in pain, so many people have information, you know, and this is really a way that we can give back and contribute and help these patients to live, you know, better lives.
Oh, that's really beautiful. You're a good man. That's really awesome. Good on you.
Well, thank you, Suvi. I mean, I think your work where you've been writing about this, I think, you know, it's just really the tip of the iceberg, that the stuff that you're writing about. You know, there's you know, once there's so many scientific papers coming out on what the light can do. I'm sure you've got heaps and heaps to write about.
I've got a few research papers here. And you're right, the research is growing all the time. It's like the director of the Bosch Institute, Jonathan Stone, actually said to me, like he said, the research is growing exponentially. You know, hospitals, research centres, labs all over the world. It's just growing. So yeah, I think you're right. It's the tip of the iceberg. So exciting times ahead with hopefully uncovering the full potential of what light therapy can do for us.
Yes, absolutely. Thank you very much for the opportunity.
Thank you honestly so much, Jason, for taking the time to chat today and for filling us in about what it can do in dentistry. And you have a really good night.
All right, thank you. We'll see you later.
See you, Jason. Bye.
Bye.
This is Amity. Do you want to say
hello? Hi, Amity. How are you going? I'm Jason.
Can you please tell Amity to brush her teeth twice a day? We have lots of battles. Do you want to pick
brushing teeth is really important.
Thank you. Thank you. Did you hear that, darling? She's gonna pick up our puppy. Here he comes. Here's the whole family.
Oh,
this is
that's
Papa.
a big puppy.